The title of this talk is Where Are We Now with Dementia-Friendly Communities? And I intend to talk for about 3/4 of an hour, and then I'll turn the microphone off and ask if there's any questions. Now, this is a quote from last week, in fact, saying, "The information base is matched in importance by change in language that embraces dementia as a public health issue. Dementia is a chronic disease, the language of prevention and rehabilitation, and the recognition that dementia is as much a social as a medical issue." Now, that was said by Glenn Rees, who's the chair of the Alzheimer's Disease International. And I think it's fair to say that these words probably would have been unheard of not that long ago. We still are in the grip of a very medical way of viewing the dementias, and the dementias are conditions which are not just restricted to old age, but will affect the structure and function of the brain, causing a progressive loss of functions of the brain, according to which bits of the brain are affected. And I think there's been a fast U-turn in methodology around this because of the rude awakening that drug companies have been less than successful in finding a cure. So it came to pass that I ended up in Australia this year, in Western Australia, for the Alzheimer's Disease International Conference this year. And I'm obviously not going to read out this list of topics I intend to cover, but to give you a flavour of the policy of dementia-friendly communities is really to reassure you shorthand, because there are about 100 different types of dementia. One can argue till cows can come home what you mean by the word friendly, and why communities, why stop it there, why not societies as in Australia had, or streets or networks, or so that I'm not going to paralyze you with analysis over that, because all of us have got better things to do. But the list will not be all-encompassing, but will give you a flavour of current successes, possibly controversies of where this policy is at, according to me. So feel free to talk to somebody else who may give you a totally different view of things. The definition we currently have in policy in this country is helpfully provided by the Alzheimer's Society, that a dementia-friendly community is one in which people with dementia are empowered to have high aspirations and feel confident knowing that they can contribute and participate in activities that are meaningful to them. Now, note that definition doesn't necessarily identify a location of where a person living with dementia might be. It could be anywhere. And activities meaningful, well, there have been debates about what is a meaningful activity in a care home, for example, and that's probably an issue for the regulator for another day. And there are other terms which have been used. I think most people have settled on the term dementia-friendly community. It's a bit like motherhood and apple pie, in that you're not going to advocate dementia-hostile community, although some language inadvertently used by some people has been quite degrading and hostile, but I'll come on to that. This paper from the Gerontologist 2015 talks about a similar definition for dementia-capable communities. And in fact, this term has filtered through certain bits of the literature. You can argue that better terms, alternative terms, might be dementia-accessible communities or dementia-inclusive communities, as Nick Swafford argued this year in Alzheimer's International Conference in Perth. So there are, to set backdrop for this, some considerations, and this is this, by the way, you will not find in textbook. This video will be on YouTube. That's why there'll be nothing defamatory in it for the next 45 minutes and more. Bear with me, this list, you don't have to jot it down, but this is indication of some of the things dementia-friendly communities do not cover. And as it says on the tin, the policy is meant to promote being friendly towards people who are living with dementia. It does not embrace the cultural diversity of people. This includes policy terms, particularly Black, Asian, minority ethnic, lesbian, gay, transsexual, people with learning difficulties. But one assumes that the diversity is there. It doesn't pin itself down to any particular country. So save discussions of private public healthcare for another area. Doesn't tell you about whether you live or not at home or in a care home or a hospital. It does address levels of what is globally called awareness, quite a rubbishy term, because you can be aware of your postman delivering a letter, but so what? It doesn't mean you have to have seen him, etc. But the issue about this is that with better public education, hopefully stigma and prejudices will be mitigated against. It's dependent on, to a large degree, on some degree of social movement, willingness of volunteers to spread a message. Now, in fact, to give you a brief comment, when this came about in England, there was some issue about whether people were being mandated to volunteer, whether this was actually squashing genuine volunteerism, or whether it was actually encouraging a lock-in to a particular charity. But these are not particularly fruitful discussions, although you could spend a long time on them. Professional attitudes, well, yeah, I think it must be the case that different people, different training will have different views, some historic, and so necessarily policy has to embrace that. And the last point is really important. The words are involvement, engagement, underplay what should be happening, which I believe should be leadership by people with dementia. Involvement and engagement rather sounds like me, pardon the phrase, bums on seats, bordering on tokenistic keeping up numbers. And yeah, that's another discussion which I'll elaborate upon as part of dementia-friendly communities. And why that is important is what one assumes the policy is not trying to promote is victimhood. Somebody once coined the term dementia aid, like Live Aid, and this, one could argue, is the wrong tone of discourse. So, the Alzheimer Society, in conjunction with various societies, have been leading on this through a number of documents. And you can lead on this without having the evidence for it, in theory, but it happens less than half of those respondents to the survey, their survey, thought this area, community area, is geared up to help with them living well with dementia. 42%, 50% think their community was rubbish or not geared up. More than half of UK adults surveyed felt inclusion is fairly bad or very bad. Now, obviously, that's not, however, you'd find the semantics of the question not a great result. So, 2013 saw the Alzheimer Society come up with a list which more or less has been agreed upon around the world. These covering issues I've alluded to. There's been some issue about early diagnosis. Do they really mean early? In other words, you can get a diagnosis of some dementia in utero, in the womb. How early do you want to get it? The terminology is now moving towards timely, embracing the idea that the diagnosis should come at the right time for that particular person. And because some of the delays in diagnosis are because some people are not given the diagnosis by doctors. Some of the reasons are that somehow the medical profession isn't encouraging diagnosis from people, or some people in the public do not want the diagnosis. But that's a totally different discussion. A lot's been written about it. The issues about community-based outcomes, I'm going to come on to that. Easy to navigate environments. In early dementia or Alzheimer's type, one of the main cognitive issues can be spatial navigation. So this would be a cognitive aid, like you would have a wheelchair ramp for people who are physically disabled, that sort of thing. And responsive businesses, and I'm going to come on to that a bit later on. So that was the infographic they produced. Do not look at it because it might do your eyes some damage if you do. But anyways, in the Alz Society document, well worth having a look. And then they came to produce an accreditation process, which various people were involved with. And this, again, is all power language. They call them standards, partly because they came from a board involved in making standards, but they're essentially specifications. And the problem with using word standards implies that it's possible to miss the standard. But the other people argued that there was some need to explain what a dementia-friendly community might mean so that it could be in some form validated. So here are the criteria, which again I'm not going to read out, but if you want to look at them on Google, it's about identifying a person in the community who can take charge, having a plan, having a strong voice, raising the profile of work. And the last point is essentially not having it fizzle out after 6 months. It's having a sustainable plan which means something for the community in future. So the background for this in England derives from a number of different sources. Here's one, not that particular lady, but that document. And their suppositions were as follows: find way around, be safe, yep, access local facilities, yep, and maintain social networks. Some of us believe strongly that people who have done relatively well are people who've geared up their networks, meeting people, talking to people, even on Facebook or Twitter, and meeting people in real life, and that somehow has a beneficial cognitive effect. And as I think probably we'll see much more on this, and this will also reshift the narrative for what living better with dementia might mean. So, 2012 now, if you remember, if you've been listening to the news in the last 5 years, and the last government, same as the new government, sort of, that this came about 2012 through the Prime Minister's Dementia Challenge in England, which turbo boosted the policy here, and whatever one's political views, it was quite a big help for putting certain aspects of policy on the map. And again, you'll see roughly the same thing that I've been saying again and again and again about what a dementia-friendly community might mean. In policy, by the way, there's quite a lot of emphasis on providing meaningful information. There's been, for the last decade or so, the idea that if you have information about your condition, you may be able to look after it better, may be able to direct yourself to services better. It's called choice and control under various governments, and under various guises has been coming under self-directed support and personal budgets. So it's all part of the same overall game plan. And making people aware of services, quite often I hear the criticism, well, of course I would access the service if I knew about it, sort of argument. So that's obviously a fault in the system somewhere, which integrated care in this country and other jurisdictions might address, joining up health and social care and mental illness health care. So these were the findings from them in May 2012. They were worried about their ability to cope, people with living with dementia in the community. They wanted, conversely, to pursue hobbies and interests, go out more, make use of local facilities. Australia has definitely been a key player on the world stage through Henry's leadership and taking a really lively and meaningful approaches. In September 2014, they produced a document on a guide to growing a dementia-friendly community. Again, similar to the one we have here. In a rather corporate manner, they applied Cotter's very famous 8-step change model, which is basically a bit of recipe book for how one might bring about change in any corporate culture, but here it's being applied to bring about a change towards dementia-friendly communities. And it's interesting, well, the first thing is to create a sense of urgency. Well, one wonders how successful this was. There were obviously G8, G7 events, legacy events, but I think the urgency that was created there was to find a cure or symptomatic treatments or technologies. I'm not sure how successful they were in creating an urgency to make life better for the 47 million people around the world with dementia, but that's for another discussion elsewhere. Form a powerful coalition. Well, actually, that has indeed happened. People with dementia have formed a powerful coalition in parallel to this policy of dementia-friendly communities. Create a vision for change. The idea that living better is a worthy aspiration. To remind you, it is a statutory obligation under the Care Act in this country of looking at people what they can do, not focusing on what they can't do, which means a more rehabilitative approach. Kate Swaffer introduced the term prescribed disengagement, where one might receive a diagnosis from a doctor or care professional and be given options on how to progress further and to be put into what could be called a managed decline. But the vision of change is that of living better through things you can do and things your community and environment can be geared up to do. And this is a very powerful contribution to the world debate. Create short-term vision, build on change. That's the idea that people want to have symbols of change. In other words, you'll find the current government wanting to say, we've created 100 communities, that sort of thing. Or here's something in the west of England, what a wonderful community they produce. So the idea is to try to propel other people to emulate the change. Now, a part of the problems have been unhelpful words like time bomb, epidemic, tsunami, tidal wave of people living with dementia. Well, sure, the number of older people are likely to increase. As I said, dementia is not just restricted to older age. Here's a population pyramid, which will quite often accompany a talk from Japan. And they produced, pardon my Japanese, Ninchisho supporters, dementia friends. A caravan movement of people who are willing to sign up to a big social movement about being trained. They use the word trained. Here is meant to be called information sessions, but sometimes accidentally slips into terminology of training. But in Japan, there was quite a big change around, changing the word for dementia, meaning idiocy, stupidity, to cognition disorder. That was statist development from 2004. So they do things somewhat differently. To be trained, to become a trainer sort of thing, you need a 6-hour workshop. They do 90-minute seminars. We do, well, I do, as a dementia-friendly champion, 45 minutes, if that. People tend to be wanting to not go home, obviously, but catch a train, blah, cook dinner. And it's all pretty standard. And it's felt that the English government, UK government rather, wanted to emulate the success of Japan. But it's argued Japan had lessons for the UK. Yeah, meaning that the befriending scheme was emulated. Jeremy Hunt, who's the Health Secretary of State rather, his wife is Chinese to my knowledge. Others have argued that focusing on dementia friends has somewhat taken people's mind off the cuts in social care funding which have happened since 2010. So here's what you could want, our programs. You could want specialist admiral nurses, clinical specialist nurses, and current policy is very much wanting to head towards, I beg your pardon, person involvement, patient involvement. I think the term is more probably person-centeredness rather than patient-centeredness, in that we all are persons who sometimes become ill, become patients, and the views of people who experience the health and care services are very important. So one of the feedback that occasionally comes up is that how some people prefer there to be a care coordinator, nurses, personalised care plans, that sort of arm policy, which Dementia Friends is not meant to address. or in fairness to them, has never claimed to address. So here is our 2009 policy. There's been a bit of a blockage in producing the new one, but there is going to be a new one next year probably. This one's called Living Well with Dementia 2009, Prime Minister Dementia Challenge 2012. And there's no need to read this quote, obviously, but one of the many themes around the world is the issue of loneliness, how people can find commonly their direct vicinity of friends contract when they receive a diagnosis of dementia. Now, some people with dementia have also argued that this sometimes comes about because people are moving in different circles. So when they're no longer at work, and people with young onset dementia often find themselves having to decide upon whether they want to stay in work or not. They move in different circles. So obviously if you change job or leave your job, that will change your social network. Notwithstanding that, across a number of years, there's been concern of the profound, I'm quoting other people, profound loneliness which can accompany a diagnosis of dementia. Sadly, some people do not still understand what dementia is. And I know that because I ask people what they understand by dementia, because it's very easy for people to preach to the converted and not actually ask people what they actually understand or what the system needs. And this is a mistake that many of us do and shouldn't. So this was the latest attempt, the Prime Minister's Challenge on Dementia 2020. Now, it's felt that this was not the strategy. In fact, it looks like a strategy, but wasn't. And I did a wording on this with Steve Moulton earlier this week. You could argue I should have better things to do. But anyway, the words which came up were unspoiling dementia. And it's interesting to see that people there care, research, all the things you discuss, sport. If you did this word cloud a few years ago, you'd actually word the word services in huge letters. That's strange. I think there's not irony there, but it happens that the shrinkage of the word services has accompanied the shrinkage of actual services around the country, in social care at least. Let's say something now about Dementia Alliance International, which is a large group now of people living with dementia who have their own views and stated positions on policies around the world. And it's important to say that they're not some cozy offshoot or any other institution. They have their own independent, autonomous opinions, and that's why they are actually very powerful in policy. And made a lot of us proud to see this all in Perth, not Perth, Scotland, but Perth, Western Australia, earlier this year in April. And on the left, you'll see Helga Rowe, who leads European Working Group members, and Chris Roberts, who's a Dementia Friends champion on the right there. Mukar Modi, who gave an outstanding talk earlier this year in one of the workshops on his affairs of dementia-friendly communities. He himself is living with dementia, and he had very many useful things to say. There's Kate Swaffer, co-chair of DAI, that is Dementia Alliance International, with John Sandblom, giving a talk on his experiences, which again was well received by the audience. So people are listening up. I've made my opinions known about the words engagement, involvement, empowerment. These are all worthy ambitions, but that apple pie in that it's hard to argue against that. I've done one project recently to do with dementia words, and people involved with that have found it very empowering, actually, and have really changed the game on this. And one of these phrases, please don't call me dementia sufferer, it's all too common to see the term dementia sufferer. I don't want to get into the do you suffer or not. It's a complicated debate. I know it's complicated. I would like to leave it there if I may. But it's crucial to pay if there are international guidelines on this. Alzheimer Australia, who hosted this year's Alzheimer's Disease International Conference, made these guidelines very widely known to the speakers there this year, and the language should be accurate, respectful, inclusive, empowering, non-stigmatizing. Yeah, and when you look at the big pictures, it involves things like sufferer, victim, demented person, vacant, dement, feigning away, empty shell, not all, attention seeker. It's really quite horrible. In other fields, one could argue it's bordering on a hate campaign. And part of the issue about dementia-friendly was meant to mitigate against the stigma. However, with every article written in the newspapers, it's quite not uncommon to find a word like dementia sufferer in the same article promoting a new initiative. That produces a rather odd perception of where we're heading with this policy. Let's quote Swaffer again. Not just challenging behaviour. Now, the reason that I put this slide up is that I'm regulated by the GMC, which is the General Medical Council. Sometimes the professionals are not helpful, are to blame, and reasons for the complicated. They've been trained for many decades. I've been to talks where GPs would call 78-year-old demented man, and you're sort of left shocked and in utter disbelief that a professional could dare to say that amongst other peers. When you have academics using language to raise funds for big grants to investigate these things, then it's very hard to tell people, no, stop, because challenging behaviour is always due to a failure in communication somewhere online. And thankfully, with Case and others in Dementia Alliance International, we're getting a change from the medical on this. I went to the Alzheimer show in London Olympia at the weekend, and the speaker did not use the term challenging behaviour at all, which I was surprised at, but thankful at. So here's one of the other players, WHO, World Health Organization, and here's one of the graphics of acceptance of dementia, which climaxes in the word normalization, but it says acceptance of dementia as a disability. Well, actually, legally it is, whether one wishes to embrace that philosophy or not. World Health Organization, with people like Margaret Chan, done great work, and you'll hear about this particularly by Arsenio Europe and John George. paralleling age-friendly cities. Well, of course, not all communities are in cities, and not all people living with dementia are old, but there are commonalities, such as the need to revisit outdoor spaces, buildings, transport, housing, social participation, inclusion, civic participation, and services. And the age thing is really unhelpful, but the graphic is helpful in that it shows that there's a shortfall which ideally one should make up. That's why I presented it. And earlier this year, ADI produced this document on new domains, global examples, and Mark Bourneman's been great in trying, given his resources, try to influence national plans and synchronizing policy. And these were some of his take-home points, which I've covered before. Jacob Roy was the previous chair prior to Glenn, and this was his list. And again, it is the same things I've already alerted to you, and he did a good job too. So here in this country, we have this thing called Dementia Friends, where you can go onto the Alzheimer Society website and sign up for 45 minutes on receiving an informational session from a Dementia Friends champion who will produce 2 or 3 activities and help you with 5 messages about what dementia is. And here's one aspect. It is, of course, liable to quite intense marketing on Twitter and places. But here they are in a supermarket. Anti-Tarsos, it's fair to say, is giving huge amount of personal energy into this. This it's not an example where policy is problematic. There are some people, if the policy is articulated thus, I don't know, who do not want to go into separate or for people with dementia. And this has been a fault line throughout this policy of inclusion, embracing people, unwittingly causing division, such as the stunt at conference this year of Stand Up If We Live with Dementia. Many people felt very uncomfortable about it. Chris Roberts is from Wales and is a leading Dementia Friends champion. He lives with mixed Alzheimer's vascular dementia at a point when the society, you have to do operation running it, but keep the activities separate. They managed to achieve more than 1 million Dementia Friends. Chris' article is there in their website. Now, to explain the baggage which accompanies this from the National Health Service, there's been quite a lot of interest in, I won't bore you with it, but I'd like to, in fact, about the issue about how what the NHS cannot cope with is another top-down organisation. If there's going to be change, it should be very much looking at patient outcomes, looking at patient opinions, experiences, values, should be bottom-up. So, anyway, this was, this call to action is based on, I would say it's factors are not particularly original and comes from various sources. And defining social movements, rather textbooky type quote there, but encompassing a feeling that we deserve better than this. And the next step is framing the precise thing you're not happy about. Now, Dementia Friends was trying to address the lack of knowledge about dementia, but you can argue that this could be applied by people living with dementia want to frame the narrative from cure to living well, for example, and that could be their message that they want to bring. And there are lots of action answers which are on the principle of subsidiarity, propagating messages at various localities, and I dare say similar instruments happen around the world. There's a guy called Philip Blond from the part of politics on the centre right, argues that actually what went wrong was the idea of individualism. Now, to explain that, he explained the best way to promote individualism was to get other people to talk to each other. And that's the best way to promote collective action. Now, this being politics, he thinks the best way to promote individualism is not a contract with a particular provider, private or public or state, but this was part of a thing called the Big Society in England, and some people thought this communitarian volunteerism was a cover for cuts, and this has always dogged the political debate about volunteerism or getting people to be involved in social movements. But if you get a chance, look up Philip Blond and his work in Res Publica. Now, in fact, this movement, Dementia Friends, has been incredibly successful around the world. There have been various versions of whether it's being emulated in different countries. Here's the emblem from Canada, Dementia Friends Canada, which recently launched their own video on trying to get people to sign up. Now, you'll notice the colour's different, but actually the same emblem. And in branding and marketing, it turns out the colours are sometimes culturally attached to send out different messages. So I actually wanted to look up what yellow meant, and it turns out in Germanic jurisdictions it sometimes can mean envy and jealousy, which obviously is not perhaps the messaging that one would want to see. But I'm saying that a lot of marketing goes into this, and one would have thought that on top of the views of people living with dementia, they would have also looked at the marketing strand of things. But yellow is a very positive colour in other countries. And there's a diagram from the same paper, Aslam, which says a lot of things convert on your perception of colour in marketing. And the problem is the messaging of this particular broadcast, I think most people agree, was not right. There are various procedurally why that might have happened, but Kate Swarther did a blog post which encapsulated what many of us felt but didn't quite know how to say, and that was awareness at any cost. There is such a good thing as bad awareness, in the same way that there's such a thing as bad weather or bad snow. Bad awareness can do a lot of damage and can be stigmatizing, and many of us felt this particular advert caused fear and did not promote dementia-friendly communities. So you can look at dementia-friendly policy at different angles. Here's one which relates to your particularly from the Joseph Rowntree Foundation, of importance, place, people, networks, and resources. And these are the elements which you can obviously see as being important to the success of any particular dementia-friendly community. This is called their 4 cornerstones model. And they found this helped with a number of different areas, that people involved with healthcare were more responsive, corporate companies were better customer facing, and people were more welcoming with people with dementia. People with dementia, I've already told you, number 47 million in the world. So the idea that they're an homogeneous group is simply incorrect. And also brings up issues about whether people with dementia need to identify themselves for the policy to be successful. But these are issues which have been rehearsed many times. So here's Bruges, in a nice city in Belgium, Bad Delta. Having dementia is very tough, but having a city who excludes dementia, that is really tough. Bruges is, of course, one of the flagship dementia-friendly cities. And dementia-friendly hospitals in this country policy deserves a bit of mileage as well. The issue is here that people do not attend hospitals due to an acute exacerbation of dementia, typically compared to acute exacerbation of bronchitis, for example. University Hospital Southampton has created a 28-bed dementia ward, brightly coloured doors, not visually loaded upon words, but visual symptoms which are easily recognisable. And there's some aspiration apparently to make all wards in Southampton dementia-friendly. But there were some things that I like to be aware of. In this country, the common government, if they can hold their government together, wants to scrap the Human Rights Act. But human rights is the international phenomenon, and whatever happens here it will not cause this to be abolished, which are the rights of persons with disabilities. And I've told you already, dementia can be classed as a disability. And I'd like to draw your attention to Article 29 there, participation in political and public life. That means democratic elections for people with dementia, not having them selected from on high. The Equality Act 2010 is our legislation in England which deals with the various characteristics like age, disability, gender reassignment, partnership, sex, orientation. Dementia is a disability under the guidance to this Act, which means that discrimination against people with dementia in policy terms or at an individual level is unlawful. And here again, one can point to the success of the disability movement of a few decades. John Evans is one. We can't give up on independent living. Well, the Independent Living Fund has had its problems, as some of you may know, but the idea at other jurisdictions called aging in place, being able to live at home, not necessarily in a care home or in a hospital. So, but then again, policy has to be very careful not to be engrossed with success or productivity you get this in the immigration argument, where people are valued according to how much money they can generate for the country. That's obviously not the right narrative for many of us. It's about equality of well-being or equality of opportunity. And equality isn't the same thing as equity. And I draw attention to this because equality is not the same thing as diversity either. Now, some in the different political sphere will argue this could be a race to a bottom, that you're making services some rock bottom, which we all adhere to, and it's not particularly aspirational, blah, blah, blah. Same argument. And this equality doesn't embrace the diversity of people living with dementia. So, the Disability Rights Commission produced a document on how to make their service better, and the Disability Discrimination Act 1995, as amended, was meant to help with this. But in 2014, we had this headline with disabled people's access to ICU shops shocking audit fines. So despite all this legislation, and there is a lot of it, there's been problems in getting this actually happening in reality, and one is worried about dementia-friendly communities being aspirational, being used for marketing, not achieving much else. This is Scottish view of their rights, right to have a donors, right to proper end of life, and they've really taken this policy head on, and good luck to them. Now, it's thought that many people would experience a very bum deal from the banking sector, and here's a list of some of the issues there. But the Alzheimer Society produced a document about dementia-friendly financial services. Cynics amongst us will point to who actually benefited from this policy. Was it actually people with dementia? There are some people who have told me they've found a sea change in attitudes and their customer experience is much better. On the other hand, one can argue it's just another way of generating competitive advantage. But as this policy is across a number of jurisdictions, and built environments, here, by the way, is a policy rainbow of factors like education, transport, housing, all the things which impact upon your well-being. And here's the definition of what is an inclusive design, welcoming to anyone, and responsive, flexible, intuitive. And it's hard to disagree with that. Now, that people in the housing sectors have produced a lot of detail on what a dementia-friendly community is. And again, we have the same issues about public spaces, signage, natural lighting, effectiveness of color coding. But this, again, is across a number of jurisdictions. So in Leuven, they have this campaign, or had one, which said, don't forget to go outside, which was an idea that people with dementia ended up inadvertently being housebound, never went outside, which is bad for both mental health and physical health. And here there was the inclusive design for getting outdoor study, which has now ended, but across a number of universities, looked at how getting outside could be enabled and how it directly impacted on well-being. Elaine Wismer has talked about dementia-friendly communities in rural Northern Ontario. Really brilliant work. I can't commend it high enough. And often I hear from people living with dementia and people who are not living with dementia is that they would like community friendly to everyone, not just age friendly, dementia friendly, but simply friendly to everyone. And this is, to some extent, epitomised in the central thesis. I like ... safety of it, the fact that everyone knows everyone, that if somebody's in your yard and if somebody's driving by and that person shouldn't be in your yard, they're going to get hold of you, and they always look out for you. And this is a diagram which just says that we're all actors, agents in a big network, and B is the person bridging two networks, A and C. A is very tightly bound, what's called a cohesive network. C is very disparate, sparse. But the point about this is that B is a person living with dementia is in a good position to brace people in a C caregiving community or A political community. So therefore B is actually quite a powerful person under this network analysis. And different environments necessitate different approaches. Here's one from Scotland, and I recommend you Anne Pascoe's work too on rural Scotland. People looked at barriers where communities go wrong, like leisure, fear of getting lost, accessibility of venues, why people do not participate in leisure activities, or education. Now, this paper in Brain, I strongly recommend to you, it's the idea that actually the evidence for preventing dementia from education is weak, flimsy at best. But there may be some idea that it could mitigate the impact of pathology, there was online, on the clinical expression of dementia, which is actually really useful. And a common myth propagates from somewhere, I have no idea where, is that people with dementia are unkeen or unwilling to learn new things, which is simply another myth. Yeah, so here's me wearing an extra large Help Beat Dementia a t-shirt, and the issue there is we need more research into living better with dementia, and less marketing and more research into what dementia-friendly communities might mean. And I suggest the best way to do this would be to systematically look at the social determinants of health, like housing, transport, leisure, and make sure all the bases covered, and look at the person involvement experience and what they get out of it. And you notice that this week in Carers Week, there have been carers-friendly communities. I humbly suggest carers often have different views to people with dementia, and it's a fallacy to necessarily think they hold identical views. So I'm going to leave there. I'm sorry, I have, believe it or not, gone through, despite one phone call, gone through 120 slides in bang on 1 hour. So I'm going to leave there. Thank you very much for your attention, and I hope that the position of you now is knowing a bit more about this policy. I know there were some very there were experts in the room, but I hope that you learned something from this talk. Thank you very much.